Well, thank you very much. And first of all, let me again thank Ranking Member Scalise and Comers for putting this select subcommittee together. Your testimony is critically important, and it is a shame that our colleagues on the other side of the aisle are not here. This is not a partisan issue. This is not an American issue. This is a world issue. It is of critical importance. And your courage to be able to testify today and bring forward the information you're bringing forward, I am extremely grateful for that. And as both a physician and a director of public health, I can tell you, Dr. Garrar, that the things that you're talking about as conflicts of interest, even as educated as we are, we're still susceptible to peer pressure. We're susceptible to the desire to be published, to be lauded by our peers, to present at conferences, and all of these things are a type of a pressure and conflict of interest, as you said. Even at universities where I've been on faculty, we were at the point where we could no longer accept a PIN from a drug company because it would be a conflict of interest in prescribing a medication. And I can say I've never prescribed a medication because I got a PIN. So what you're talking about is extraordinarily sobering. And it's not just that 600,000 Americans have died of COVID-19. We forget, or we haven't mentioned, the millions worldwide. I asked Dr. Walensky of the CDC in April when she testified before our committee, how many excess deaths were there in 2020? 500,000 excess deaths. Those are from cardiovascular events, Dr. Quay, cancer that was not detected, people who did not go into the emergency room, cancer that was not treated, diabetes that wasn't treated, drug overdoses, and suicide. There was an article last year that in San Francisco alone last year, there were more deaths from drug overdose, far exceeding the deaths from COVID. The number of deaths from youth suicide, which is a tragedy in this nation because of our response to COVID-19 and the pandemic, we will never recover. Even the World Health Organization has talked about childhood poverty, which is much greater than 15% higher, and it will be decades until we recover the grounds that have been lost. So when we're talking about holding the Chinese Communist Party accountable, or the pressure there is among scientists to be able to convey information simply because they didn't like who may have espoused that information, those are issues that we have to address, and we have to address as a nation. So thank you for that. And I know that you all actually had information you wanted to convey and were not, so I may just leave my time for information, but I did want to ask just two brief questions. One, Dr. Garrar, if we had known about the magnitude of the virus sooner, do you think our response would have been different?
Yes, I do. The CDC has had its ups and downs during the response, but the one thing that the CDC does better than anyone in the world is get on the ground, investigate transmission, and let us know about the virus. And if we could have known about asymptomatic transmission, 2 months beforehand, it could have potentially saved hundreds of thousands of lives. So, I do believe, and I wake up at 3 o'clock in the morning still thinking about these questions, that, when you get to the ultimate source of death, as the CNN would say in the autopsy, it was a lack of Chinese transparency early on. If we could have had that, sure, people would have died. We would have still had it throughout, but I think we could have had interventions much more timely because we would have known so much about the virus. That's my opinion. That's not science per se, and I will defer to that, but that is my opinion, that we would have done something differently, and the CDC were the exact people we needed on the ground in China to make it happen.
Well, I would say the same thing about treatment modalities that we were not able to discuss as physicians because we were censored or suppressed. And this is for any one of you. Are you aware, and how many variants are there of SARS or MERS? Dr. Quay?
Are you speaking of SARS-1 and MERS? Well, the variants are defined as numbers of infections. So, it's basically, with SARS-1, it's very limited. There's only like 3, I think, and in MERS there's 2.
Naturally So the fact that we have so many variants already of SARS-CoV-2 and so rapidly, does that shift us away from a naturally caused evolutionary disease? Does it shift it more towards work in a laboratory or manipulation of it could be either a man-made virus or a naturally occurring virus that was manipulated.
Yeah, I don't believe that event does, because what you have is under 10,000 human infections with SARS-1 and with MERS, and so that'll generate just by naturally a certain number of variants, and then you've got 200 million over here. I want to just comment on something that he said that I think really needs to be amplified, though, is it was important to know a human-to-human spread early, and that would have been especially useful. But I have to tell you that the concept of asymptomatic spread, which was very unknown and which I believe may be part of ORF7 modifications that occurred in the virus to make it more asymptomatic, is the real, to me, is that is the cornerstone of having saved so many lives, if we'd known about that.
Could there have been genetic manipulation to make it more transmissible or
the Wuhan Institute
deadly
of Virology
in
has published
age?
between 2015 and 2018. I don't remember the exact year, but they published papers on playing around with ORF7, changing it to see how the interferon response was. And I think they had like 3 or 4 different high interferon, low interferon, no interferon, and this was done in another backbone. But they did that work. They did suppression of the antigens on the spike protein. They did ORF8 to show who they could kill and who they couldn't in other viruses. And so all these pieces are in SARS-CoV-2 as well.
And given the information that you all have revealed today about, basic levels, exporting our biotechnology, are you concerned about the president being willing to give up the intellectual property protections for the vaccines?
Okay, conflict of interest. 87 patents and 7 drugs I've invented. So I like patents. But then on just, if I can, beyond that, yeah, I think so. I mean, I think because we're willing to throw around so much money here, there's probably another way to do it without breaking something that was in the Constitution we started with and has worked pretty well. I actually teach a course where patents are the foundation of America's success, because one family like mine in the 1800s got to make fruit crates for 2 generations, and then they gave it away. And so everything you see around here was patented at one point in time, and it's an incredible engine of commerce.
Dr. Mueller, did you want to add something to that? Then I would say, obviously, it's important to protect it so that you all can continue to develop patents.
I just want to say that, number one, I think patents are critical for innovation. But number two, it's completely naive of this administration to say we're just going to give a patent away for a sophisticated manufacturing of vaccines that takes years and billions of dollars of expertise. We're going to give it away so somebody else can manufacture it. It's just naive. It does not make biological sense. It's a fantasy world. What needs to happen, if you want to do that, is exactly what we did on the administration. Have an option to buy 2 billion vaccines, have them manufactured by the companies that have patented them, and then give them to the world. You don't give this technology to other countries. Number one, it violates our patent and innovation, but number two, they can't do it because you're going to have contaminated vaccines, bad vaccines, and then you run the entire vaccine network.
In addition to which, both Russia and China have been known to spread disinformation about our vaccines, which have been very effective. So thank you for that, and I yield back my time.
Thank you for